There's a combination of three natural supplements that research shows can reduce inflammation as effectively as over-the-counter painkillers: curcumin, boswellia extract, and black cumin seed oil. And the science behind why they work together is actually fascinating. Think of inflammation in your body like a complex factory running overtime. Most anti-inflammatory drugs work like shutting off one machine, but these three ingredients each target different parts of the whole system. When you combine them, you're essentially attacking inflammation from three different angles at once. Here's what actually happened in the research. In 2024, a clinical trial with 201 people suffering from joint pain tested this combination against acetaminophen. Within an hour, both groups experienced similar pain relief. But by day 7, the natural combination had reduced pain by 72%, and, this is the interesting part, it also significantly reduced the emotional distress that comes with chronic pain, something the pharmaceutical didn't touch. So let's break down what each ingredient actually does. Curcumin, which comes from turmeric, is like a master switch for inflammation. It blocks something called NF-κB, which basically controls hundreds of genes involved in inflammation. It also inhibits the same COX enzymes that ibuprofen targets, plus LOX enzymes that most drugs miss entirely. The problem is, curcumin by itself is almost useless because your body barely absorbs any of it. We're talking less than 1% makes it to your bloodstream. But when you add black pepper extract, absorption jumps by up to 2,000%. This isn't some wellness blogger claim, it's published research. Boswellia extract comes from frankincense trees, and it does something unique. While curcumin is blocking multiple pathways, boswellia specifically targets 5-LOX, an enzyme that produces inflammatory molecules called leukotrienes. These are the compounds that cause much of the swelling and stiffness in conditions like arthritis. What's remarkable is that boswellia doesn't just reduce inflammation. Studies show it actually protects cartilage from breaking down. Black cumin seed oil is where things get really interesting. Unlike the other two, which block inflammation after it starts, black cumin works earlier in the process. It modulates your immune system, increasing anti-inflammatory signals like IL-10 while reducing pro-inflammatory ones like TNF-alpha. It's addressing why the inflammation started in the first place. A 2025 meta-analysis found something surprising. When you combine curcumin and black cumin at just 60% of their individual doses, they work better together than either one at full strength. The same synergy happens with curcumin and boswellia. One study found this combination outperformed Selexicab, a prescription anti-inflammatory for knee osteoarthritis. Now, if you want to try this, the details matter. For curcumin, you need 500 to 1,000 milligrams of a standardized extract with 5 to 20 milligrams of piperine from black pepper. Regular turmeric powder won't cut it. You'd need to eat spoonfuls to get a therapeutic dose. For boswellia, aim for 300 to 500 milligrams standardized to at least 30% AKBA, that's the active compound. And for black cumin seed oil, 2 to 5 milliliters daily, or about 500 to 1,000 milligrams in capsule form. Take them with meals containing some fat. This dramatically improves absorption. Split the doses between breakfast and dinner for better results. Here's what you need to know about safety. All three can thin your blood, which means if you're on blood thinners or planning surgery, this isn't for you without medical supervision. Black cumin seed oil particularly interacts with many medications, including those for diabetes and blood pressure. Quality is crucial. The supplement industry has serious issues with contamination and mislabeling. Look for products with third-party testing from USP or NSF. For curcumin, formulations like Mariva or BCM95 have clinical studies behind them. For boswellia, Opraflex and 5-Loxin are well-researched options. What makes this combination compelling isn't just that it works, it's how it works. Instead of simply blocking pain signals like most medications, it helps address the underlying inflammation through multiple mechanisms. People in studies reported not just less pain, but better overall function and quality of life. One researcher described it well. These three ingredients together create a comprehensive anti-inflammatory system that rivals pharmaceuticals, but with a better safety profile for long-term use. Is this the absolute best anti-inflammatory combination in the world? Based on current research, it's certainly one of the most evidence-based natural options available. The key is using quality products at the right doses. What do you think? Does tackling inflammation from multiple angles make more sense than the single target approach of most medications? Like and subscribe if you enjoyed the video.